All right. Again, I want to welcome everyone and thank you for joining us today for Lily Mae Francis on our Saturday session. Today we have licensed professional Danielle Curley, and she's going to speak to us today about Therapy 101. Um, Before we get started, we do have a disclaimer. This group session is intended to provide information and support related to mental health wellness. Any information or advice offered during this session is not considered a professional or clinical diagnosis. If you need professional or clinical support, please be sure to reach out to your primary care provider or other mental health resources in your area. Just a couple of ground rules. Please always try to be respectful of each other, try not to interrupt, and remember that everyone's opinion matters. Okay, Miss Danielle, it's on you.
All right. So one, thank you for having me. I'm Danielle Curley. Can you all see the screen? Can anybody confirm seeing the screen for me?
I can see the screen.
Nikki?
Yes, I
Okay,
can see it.
cool. All
Sorry,
right.
I didn't
So
mean to leave you hanging.
no worries. Okay, so just a couple of things housekeeping wise before I even go further. One, I want to make this very conversational because it's a lot of information. Therapy 101 is a presentation I really designed thinking about a lot of times we don't know what we don't know. And so I want to really offer opportunity to ask questions. If it's something that I don't know, I have no qualms about saying I am not sure, but I'm happy to take questions. And if it's something I need to follow up on, I have contact information that I can provide to you, and hopefully you feel comfortable exchanging it with me. Second, I noticed that people have cameras off, which I actually like because I think talking about mental health and therapy a lot of times can be a very vulnerable space to be in. And so, especially for some of the activities that we have, that might be a really good thing. And hopefully that could encourage people to be more authentic and genuine in some of their responses. We also have a chat function. So if you do have a time where you have something that pops in, feel free to put it in the chat or yell it out so that we can respond to it. Otherwise, I'm Danielle Curley. I'm a licensed clinical social worker and a licensed clinical addiction specialist in the state of North Carolina. Right now, I do work for a hospital system. Of course, today I'm presenting on the topic of Therapy 101, and all of these views are my own, not representative of my work, but I'm happy to share where I work after this presentation. So let's get started. The first thing I want to do is kind of have an icebreaker like many things, and this is a word association. Um, One of the things with word association, if you're not familiar, is we all have ideas about things. We have images, we have schemas, we hear a word, something comes to mind. And that something might even be a blank, but there is something. So I want everybody to take a second and look at the screen. And I'll say the words out loud as well. But when you hear the word therapy, what are some of the things that come to mind? Feel free to drop that information in the chat. So I'm seeing trauma. Anybody else have anything? Mental well-being, feelings. Okay. What about healthcare? What pops in our brains when we hear healthcare? Money, physical well-being, insurance for sure. And lastly, self-care. What are some of the thoughts we have around self-care? Spa day, yes. Relaxation, peace. Yes, all of these things. And I can say for me, I had very similar thoughts when I think of these words. Um, the reason why I chose those words in particular are because today in our kind of our media climate, many of us are either involved in social media directly or we're at least impacted by it. And our general media as well, news, print, what have you, we are seeing a lot of information about mental health. And we know that the way we think about things and what we associate with certain topics, that in a lot of ways dictates how we go about engaging with those services. And so when we think about therapy or healthcare and self-care, and I say, oh, I'm interested in therapy or I'm interested in X, and I tell you, well, therapy is a part of your healthcare, but your thought is, well, healthcare means it's going to cost money and I don't have insurance, then that's already a barrier in and of itself. And so it's really important to kind of break the ice and think about how are these things impacting the way that I look at approaching a situation, before I even really get into the space of finding a therapist or finding the type of therapy that works for me, or where do I even look? What's going on here? So after you kind of go through that, let's say you have some positive associations with those words, therapy, self-care, and healthcare, because they're all interrelated. We start to think about, why are people going to therapy? So I've created a couple of points that really are representative of the things that I've seen, one through my education as well as my experience in the field. Number one, people want to increase their insight. A lot of times, increasing insight is the type of therapy that we see modeled on like television. The person that goes to therapy once a week, every day for the rest of, once a week for the rest of their life, they sit on the couch and they just kind of talk about what's happening. They're just really developing some thoughts around experiences and building on that. And a lot of times, theoretically, insight would breed some type of change, but it doesn't always have to happen. So that's one reason. Another reason people are showing up in therapy are to process experiences around grief and loss, phase of life transitions, and or trauma. Grief or loss doesn't necessarily mean that there is death. It could be the grief and loss of a relationship, job, things of that nature. Phase of life transitions also could include graduation. We see a lot of people who have transitioned into adulthood in the midst of the COVID pandemic, and that has presented challenges that their parents had no way of preparing them for. We've not lived through experientially this type of pandemic before. So when you think about a person transitioning from high school to a college age or into a workforce that finished school the last 2 years in the pandemic where it was online, they missed out on a lot of social development that others might have had. And now they are in this world that they're not really familiar with. They've not had all the other chances to practice skills that many of us might have had as young adults. Did someone have a question? Okay. And then we think about trauma. Of us have been exposed to trauma. A lot of times we hear people talk about it as big T trauma or little T trauma, but trauma happens in our lives, and depending on where we are in our developmental stages, we don't know when it's going to show up or how it's going to show up, what might trigger it, and that might be another time that someone decides they want to go to therapy. Another area is to develop or enhance specific coping skills. Back to what I was saying about the pandemic, and I have a little aside for building community. The pandemic has really shifted the way that we interact with other people. Starting in 2020, everybody went to work one day in March, and then many of us went home and worked from home for a long time, or for those who didn't, continue to go out into the workforce and provide care for other people. And that was all that we could do. It took away opportunities to maybe go to the library regularly, interact with your grocery cashiers, seeing the same people you would typically see when you would go to the movies once a week, spending time with your elderly grandparents if you have them, and these other things that for us were just a part of a routine, but there are also ways that we've continued to maintain community. When all of those things are lost, that was a part of our coping skills. It was a part of our supportive network. And so when we think about how are people showing up to therapy, and one of those newer areas that we start to see is developing and enhancing skills to build community, because that's a very important part of how we are effective in regulating our emotions.
Danielle, I have a question.
Yes.
Could you give us a little bit more information about what's behind like big T and little T in regards to trauma?
Yes. So let's talk more about trauma. A lot of times, specifically with therapy, people think about things such as like post-traumatic stress disorder or PTSD. We talk about big T trauma as things like someone being abused physically, emotionally, sexually. We think about someone maybe having a serious motor vehicle accident, gun violence, things of that nature. For little T trauma, we think about things that might be more along the lines of, and it sounds weird to say this, but someone who might lose their housing, right? Someone who experiences consistent food insecurity, where we think about that typically as a crisis situation, but there are people based on just because of the circumstances of life, this is something that happens to them frequently. And that is a traumatic experience. They may look back over their life and they may say a period of X amount of years where they consistently didn't know where they were going to sleep at night. That's a traumatic experience. But that is not the big T trauma that people typically associate with, oh, this is traumatic. You got to go to therapy, because at some point someone might have said, well, this is just my life. It's the way it is. And I can't just stop living. I got to keep going.
Okay, thank you.
You're welcome. That was a good question. Any other questions? So now I really would like to stop and do a little bit of an activity. A lot of times when it comes to therapy, right? We've talked about how we associate healthcare and therapy and self-care with ourselves. What are the ideas we have around those things? How does that relate to us? We've spent some time talking a little bit about what trauma could look like, what are reasons people are going to therapy. At a certain point, somebody might take those ideas and say, okay, I think it's time for me to find a therapist. One of the most directed ways people are doing this is just going online and searching for a therapist in their area. They may choose Psychology Today. They may just simply type therapist, like I live in Wake County, therapist Raleigh, North Carolina. And one of the things that you'll see with a lot of the online services like Psychology Today, which is a website that simply is a platform where a therapist can purchase a profile or pay for a subscription. They can put their picture and a biography of themselves and their contact information. You're going to see their photo. You'll see a little bit of information about them. And then you'll make a decision. Okay, well, maybe I'll reach out to them. And so what I would like for you to do today is just look at these four pictures, and we have a little made up bio. This is not one that came from any of these people. And this is written this way because oftentimes this is how little information you are going to have. So I'm going to read it out loud, and I want you all to just choose which therapist you're going to work with, because many of the bios look exactly like this. Some might be a little more catchy than others, but they oftentimes kind of boil down to this. And I want you to choose which therapist you want. So their bio says, hey, at Therapy 101, we believe in aligning our lives with the experiences we desire. I'm a licensed clinical social worker in North Carolina with 10 years of experience. I typically utilize an eclectic approach to treatment by combining tenets of psychodynamic theory with cognitive and dialectical behavioral theories to support my clients. I accept the following insurances, and it'll go, da 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 da, and sometimes they might even say, um, I enjoy working with adults or persons over X age. And let's just pretend that you had insurance, you're in the age group that they work with. So, for all things considered, it's affordable within your budget and meets your time requirements. Which therapist are you going to choose? So, let's take about a minute and pick one.
And you can drop it in the chat. I'm thinking, top left, top right, bottom right.
Mm-hmm.
And I hate to be needy, but since I'm in a car, I can't see. Is there a description for each?
Sure. Yes, we
Okay.
have a white female therapist that appears. I'm guessing maybe she could be between 25 to 35. We have a African American female therapist that appears that she could be maybe in her 30s. a white male therapist that appears to be 40 to 50, and a Black male therapist that appears to be in his 30s.
Okay, thank you.
Yes, ma'am. And Miss Lynn, you're driving, so if you want to just shout out yours, that's good to go.
Yeah, that's what I was gonna do, but I didn't know when, you would be
Oh,
ready
you
for me
can
to shout it
go.
out. So,
Yes,
okay.
ma'am.
So my first thought, and it actually was gonna be my question, but you got to it before I could ask it. But my first thought would be obviously the Black female um doctor, and just simply because I feel like they may have more insight to my experiences, my life, my culture, right? My
Mm-hmm.
community, the things that I grew up knowing. And I don't remember who it was. It might have been Denzel that spoke one time about race versus culture and all of that. And, in deciding different things for movies, somebody that understands what the sound of getting your hair straightened sounds like,
Mm-hmm.
and
Mm-hmm.
that you have to, hold your ear, or else what, and so all of those things. And so when I say I need somebody that understands my experience, that's what I mean. Somebody
Mm-hmm.
that remembers somebody having a bunch of grease on the back of their hand and sitting at the in the kitchen, And so I think that, and that doesn't necessarily mean that a white woman would not understand my experience, but it's just, or that the Black woman may understand my experience, right? She may not have ever gotten her hair straightened. She may have grown up in a different time, where you just went natural, or you just went straight to perm, or whatever the case is. But
Mm-hmm.
my thought process and that decision making, without knowing all of that, I would choose the Black woman, just because my thought tells me that she would understand me more. So
Okay.
that was my
And I'm
long-winded way of saying the Black lady.
And it
and I'm
looks like, Danny, I don't know if you can see the chat. You can't, can you?
yes.
Oh,
Yes,
okay.
I can.
So everybody
Mm-hmm.
picked the same therapist. So she's in business.
Okay. Does anybody else care to maybe share or build on to some of the things Ms. Lynn said, or have any other reasons why you may have chosen the Black female therapist?
Well, I actually was torn. Torn. While I identify with the young black therapist and figure he could probably do some things, I have to consider that the older gentleman might have more life experience. So
Mm-hmm.
I'm kind of in between. So because I feel like me as a person, I'm fairly relatable. I have exposure to a vast demographic of people, so I don't feel that I'm necessarily restricted by color,
Mm-hmm.
and I feel like I can communicate my point fairly well. So common ground is not a hard thing to establish.
Hmm,
Good.
that's a
Okay.
good point. As far as common ground, and I guess rapport plays a big part in that as well. And looks like Miss Shanice agrees with you as far as I guess the common ground. And I'm assuming in regards to like the age and having more experience might be a benefit.
Mm.
Um,
Yes.
so I picked the African American woman as well. But then while Lynn was talking about the shared experience, I took it even further. I was thinking, well,
Oh,
the black
sorry,
male
y'all.
might know about, he might have sisters, so he might know about the pressing, the hair pressing. Um, and then I don't know, I just kind of went down a rabbit hole with it, of thinking how people might, even consider, even if we're going to stay, if I'm black, so I feel comfortable with a black therapist. So then, man or woman, maybe I had a bad relationship with my mom, so I don't feel comfortable, or I don't trust women, or I don't feel women, listened, or I can share, or maybe I think women are
Mm-hmm.
judgmental, so I might go with the male. So I guess there's a bunch of different dynamics that people would have to kind of consider when they're going through this selection process.
Mm-hmm. Good. And I saw Miriam, looks like Pat was agreeing as well with the comments about life experience in the chat
Mhm.
box. Okay.
The funny thing that that makes me think about that, though, is, I guess I'm kind of, if let's just say that there was not a Black woman, and so there was the Black male, the white male, and the white female. My first choice, if there was no Black woman, would be the white woman. And I'm, I'm partial to the woman experience too. And so, yes, Nikki, that he could have had sisters, but I don't know that. I mean, he could have a wife, right? But he got a mama. But yeah, but that doesn't necessarily mean that he gets maybe the woman aspect of it. If I'm talking about, being a mother and a wife as, part of my struggle with some type of, balance in my mental health, right? And so, and again, these are all just assumptions that we make, because a man could very well, do the job the same. But my next choice would still be a woman. It just would be, the next choice of female, no matter what color she was.
And that alignment is similar to what I do with my physical doctors. Like I would choose a woman first, and then if there was a Black woman, I would choose her over any other woman. So it kind of goes, it aligns my physical and mental health with people who I feel I can best relate to and kind of understand my unique experience.
Did everyone who would like to share something have a chance to share? All right. So one, a lot of the things that y'all did share kind of really feed into this next slide. So the point of that activity is, and someone touched on it, is a lot of what we're going into, especially for those of us who might be limited in information as we're choosing a therapist or new to the therapeutic process, is what assumptions we have to make based off of what little information that we have. And so we're looking at a photo and we have to think about, okay, this is all I got. Let me pick something. I need to get started. I'm feeling depressed. I'm feeling X. I need support. And so I want to talk a little bit about, what do I want to find out? These are some things that I believe would be really important to help you make the decision. Unfortunately, sometimes finding a therapist can be a little bit like shopping. And I do know that that can be difficult, because you don't want to be in a situation where you're having to bare your soul with anyone and then find out that this isn't a good fit for you. But one of the things that many people do offer are consultations, which is not an intake, but they may get a little information from you and you can get some from them as well. And this is some of the information on this slide that we can review that would allow you to maybe better navigate that, so you can figure out if this is even a place that you would want to go. And hopefully out of the internet and marketing that people do these days, you'll be able to easily find this information. So what do we want to know? Number one, what do you want from the experience? So do you want to get insight? Are you trying to process something? Are you looking for validation? Are you looking for specific skills? So when we think back to the bio, it is that they list, it may take a little bit of research if you're not particularly familiar with some of the methods that they list, if they list them. But if you know that, for example, and I'm just going off of what Miss Lynn mentioned, and she said, I wanted to know that someone could connect to me culturally when they know what it's like to be sitting there the day before Easter, Saturday night, it's Easter Sunday, and we getting this hair press. And I might want to develop insight or talk about my experiences growing up and what that meant for me as a person, then I know that I'm looking for someone that might be able to provide a psychodynamic or psychoanalytic approach or something like that. So when I know that, I'm able to tell this person, hey, I'm really looking to develop some insight. I might not have all that language or clinical jargon, but I can say, I'm wanting to talk about these types of experiences. Is this something you can support? Or if it's something very specific, where a lot of times people have found, they say, I just really want to work on how I can become a better communicator in my work. This is the specific experience that I'm having as a new leader at my job. Then that's also something that's very specific, and they may find someone who provides skills for that in a short-term model. So it's number one, figuring out, what am I looking for? The second thing is, and I think a lot of this, you all did a very great job that I kind of didn't anticipate, but thinking about who is the person that I cannot see. A lot of times we tend to do better when we say, well, who do you want to see? And it's like, well, I don't really know. I'll take somebody. I just want this, this, and this. But a lot of times we are able to really say, okay, I don't want X, Y, or Z. Kind of like when you're picking out a restaurant. So number one, what are some of the biases that you may have? All of us have biases. That doesn't mean it's a negative thing. We all have lived experiences, and those experiences, to an extent, impact the way and lens that we see the world. And so we have to consider that as we're going through things. Sir, I'm not sure of what your name is, but as you were talking about, you said, you can pretty much get along with most people. You're very personable. And you mentioned that the older gentleman looked like he could have, just because he looked a little older, might have more life experience. And so for you and where you are in your life, that might be something you're looking for. So he might look to find a therapist if he has a visual of them that might be able to provide that for him, or at least to see how many years of experience they have. And so that's something that he knows. If he sees a therapist that says, I have, 4 years experience, and or he sees a picture of them and they appear to be quite younger looking, he might not decide to go with them. Second, does this fit your schedule? One of the hardest things that I've seen is people who want to do therapy very badly, but because of life, they cannot with that particular therapist. At the end of the day, we have to think about our hierarchy of needs, and that bottom line of like food, shelter, clothing has to happen before we get into all this other stuff about self-actualizing and relaxation and all that other stuff, all these other, emotionally regulating things, because you have to be able to provide food for yourself, or at least find resources to do so. So if you know that you work X hours and your job is not flexible enough that you can have, an hour of your time or whatever your agreed upon session limit is to meet, then we don't need to even sign up for this. And it's really hard to think, oh my God, it took so long to find this person. But it's going to be even harder if you start to break into what's happening within your life and processing things, and then you have to keep stopping because of work or other obligations that are in the way. And another one of those things could be your budget. Now, early on in this process, the therapist, the practice, whomever should be sharing with you, this is what the cost is going to be. If it's insurance, your insurance provider needs, you can get that information from them. In some places, especially if you're at a system like a healthcare system, they might have someone on site they can support you with reaching out to your insurance provider to get that information for you, so you'll know this is what my copay or co-insurance may be. But you deserve to have that information up front. You should not be going into any of these experiences blind and then receiving a bill on the back end and not knowing that it was coming. Another thing is, do I understand their theoretical orientation? And if not, am I comfortable asking? So I put this here specifically because myself, I am a therapist that is trained in dialectical behavioral therapy. And that particular therapy was developed for people who have experienced, it was targeted towards people who have borderline personality disorder and people who are chronically suicidal. But one of the components of that is someone who's experienced a lot of trauma, and many times they've had a lot of invalidation and abandonment. And what I've seen clinically is they challenge people a lot because why do I want to get comfortable with you if you're going to maybe abandon me the same way everyone else has? And so I always like to make sure that if they have any questions, or if they want to know, well, why would you ask me this question? No matter what language, tone, body language they use, I always want to make sure I support them in answering that, so that they can understand where, what clinical interventions I'm using, and really establish credibility that I want to do what is best for them based on what they're identifying as their needs. If you're with a therapist and something is happening within, whether it's the consultation down to you're in the middle of your therapeutic experiences and your sessions, and something is happening and you're not comfortable asking those questions, that's a time that we might need to kind of stop on the treatment end And I want you to feel empowered to ask them those questions. You deserve to know that. That's a part of your treatment. The same way that if you were seeing your primary care doctor and they said, okay, I want to put you on blood pressure medication. And no one has said anything to you about any blood work that was done. You've not seen any test results from anything. You might naturally say, well, hold on, I don't recall us talking about that. Where is this coming from? And I understand everyone's not comfortable with that either. But healthcare is for your benefit. This is your care. And it's hard for you to work towards a goal that you don't understand and you can't articulate yourself. So when you're with someone, if you're with a therapist specifically and you can't ask them questions about what's happening within the treatment model or within sessions, then maybe that's not the best person for you.
And Danielle, what would you think for people, because it is difficult for a lot of people to kind of advocate for themselves in that space? Could you give us kind of some examples of like, layman's questions to ask? They're probably not going to know, a person new to therapy, probably not going to know theoretical orientation, right? To ask that question. But what could they say to kind of get a better understanding of what model is being used and how it benefits them?
Right. So one thing that I often hear people say is, and so for just background, most of the patients that I get at this point are referred from their primary care or a specialty care provider, like neurology. And so they might say, I'm feeling increased anxiety or I'm nervous about this and I want that to go away. What do y'all usually do to make that happen? Or what type of tools do y'all have to make that happen? That's usually what the question sounds like. And I kind of explain that to them from there. These are some of the things that I usually think of, and I kind of break it down from there. But any type of question, when you say, this is what I want to do, how do you go about doing this?
Got it.
So and it can be that simple. It doesn't have to be I did put that term on here, and so and I put that term specifically just because I think sometimes what I have seen, because also in my current role I do supervise some other therapists, and so I do know that when they have a patient who will use a term like that, I do notice that they explain things a little bit better, I feel like sometimes. So I do want to give you that if you're not using that. But you can just say straight up, this is what I want to work on. What are your ideas about how to do this? Or what do you typically do?
Thank you. That makes sense. And also the other thing that you said about giving clients the words so that people kind of stand at attention and give them full information and full knowledge, because they're like, oh, they know a little bit something more than the last person knows. So I'm going to go a little bit more in depth with the information I give them. So I think that's also a good suggestion. Kind of know the words, know the language. So when you go in, they kind of know that they're dealing with a person who is a little bit more insightful and a little bit more, I guess, willing to be engaged in the process.
Yes, and the main reason I'm saying this is because I know where I work, we have patient transparency with our notes, and a lot of systems have that now. But there's also a lot of systems don't, where maybe you go and you see your provider and you don't have immediate access to your notes. But if you can say, once you start to learn some of the language, some of the clinical language, you can take that and Google some of these things on your own. Now, I'm not suggesting that you just go out and Google random things and try to apply it without support. So I want to make that clear. But I think it's important because you ultimately, unless you are a person who says, I enjoy just having someone that I can, or a safe space to go to develop insight, like we talked about in the beginning, like the TV version of what we typically see of therapy on the couch every week. Therapy was not meant to, and this for those of us who are paying with insurance in this insurance world, is not meant to be forever. So ultimately, you should be getting something, whether it's skills, essentially some skills, techniques for your toolbox, that once you leave that therapy room or virtual session, that you can pull out and use within your life where you don't need the therapist anymore. And the more information you have, you're more empowered to, you can Google it yourself. I mean, it might not be, because sometimes I like to have handouts for patients if they need it. But perhaps you lost your handout, right? It rained, it's raining today, and you lost it. So now you're trying to figure out what was that thing we talked about, but you remember that I said it was from cognitive behavioral therapy. You might Google CBT and downward arrow or something, and now boom, you got a list of things, and you can kind of research, okay, that looks about right. I think this is the worksheet, or here's some steps that are similar enough that I can kind of replace it and keep this in my little folder or wherever it is that you might have had it. So these are just other ways that you can empower yourself for life beyond the therapy room. And then the last place here about things that we want to know about therapy are different types of therapy. I personally think this is the hardest area to learn about, coming in without any information. There's so many words, as we've been discussing, they mean all these different things. And so starting with the most basic is psychotherapy, which is just talk therapy. Usually when someone is saying therapy in terms of mental health, that's what they're referring to. They may also say counseling, but we're just talking about your general talk therapy. You're going to come in, you're going to communicate with someone. This is not to say that you won't work on skills or any of the other things we've talked about for reasons why people will go to therapy, but we're just talking about you coming in and having some back and forth exchange with a provider. Other therapies might include biofeedback in other ways. So like electroconvulsive therapy, which a lot of people are surprised is still around. And it sounds a lot more jarring than it is. A lot of times you will see it as ECT, and a lot of times it's typically used for people who have had a treatment-resistant disorder, or they might have had some other medical challenge that is also impacting their mental health. And the electroconvulsive therapy is more invasive. It will be done by a medical doctor, which a psychiatrist is a medical doctor as well. And you will be put under anesthesia, and they will induce a seizure, an electric seizure, essentially for about 18 seconds or so. And then that is an ongoing treatment, and people do that. They will determine the amount of sessions, but it's quite costly. But there are clinics that still do that in Wake County and across the state. And I do work at one of them. Another therapy that is out there that many people have utilized for a lot of the treatment-resistant things like depression, for someone who's been depressed for quite some time and they've tried medication and they've tried therapy in conjunction and all these other things, is the transcranial magnetic stimulation therapy, which is a lot of times shortened to TMS. That is what I would like to call the less invasive ECT. They do not have to put you under anesthesia, and they will put some magnets onto your scalp, and they will also stimulate like a magnetic electric shock across your brain. It'll do the same. You can go home the same day. You can drive to it. Unlike ECT, you would need someone to support you. And then lastly would be some of the group therapies. And group therapies typically look like a process group where you would be in group with other people and you could talk about things and process emotions and feelings and, what we would typically see and think about as a group experience. And then you have skills groups where you will still talk to other people, but it's sometimes and many times set up more like a class. Now, I know I said a lot of things, so is there anything that I could maybe explain a little bit deeper? Is there anything in the chat? Because I can't see the chat right now.
No, there's nothing in the chat yet.
All right. So we'll move forward. So I I know we talked about the therapies and we talked about looking at psychology today to get into treatment, but understandably, that's not always how we end up there. I think that using psychology today is really great for us when we're in a space when we have more choice about therapy. Sometimes we find ourselves going through life, and before we know it, we need the help that we didn't realize we needed. And so that's why I wanted to talk about some of the other ways that people may find themselves accessing therapy. One of them is through your primary care provider. These days, so many of us may be accessing primary care through a larger system like Wake Med, UNC, Duke, and they have access to therapy within the system where they can make a referral for you to someone within their system, or they can make a referral to a community provider. Many of the primary care offices these days have LCSWs that are on site that can provide therapy at that office for some time. Um, so that's one of those ways. Another way is through community events. A lot of times, one of the places that I met Nikki was at Southlight Healthcare when we worked there briefly, and they are participating in a lot of community events. They're at a lot of things, supporting the community as many other agencies are. And so if you're someone who does maybe go out to, I'm just throwing out here like the farmer's market or somewhere else, there may be agencies that are on site that have a booth set up that are giving out information. They can help you get set up with a referral or appointment at that point. So that's another way to learn about them. And lastly, that's going to be emergency services. Unfortunately, there are times where things in crisis happens with us where we just need help and we need help right now. So that might look like calling 911 and going to the hospital and allowing someone else to support us in coordinating that care. And they have access to whether you need something inpatient at that time to help you to stabilize in whatever crisis led you to that place, or just to allow you to get resources so that you can connect after leaving.
So Danielle, I do have a question in regards to emergency services.
Mm-hmm.
Within the community of people of color, there's a lot of fear of any contact with emergency services. You might call the hospital and the police show up. Is there a certain type of or any type of protocol that would kind of secure safety or increase the safety of the person that's experiencing the crisis and getting them to the resources that they need, like during that transition?
Yes. So one of the things that I would suggest, well, one, I mean, first off, validate that, especially for people of color. We can't, we would only hope that people could show compassion in those moments. I always, especially if you know that you have a behavioral health or substance use need, and I know that's not something I talked about a lot, but I want to touch on that once we get to the end of this. If you're calling the police and you know that you're working with someone or you're experiencing a behavioral health need, mental or substance use, if you are a person who separates them, ask for a CIT officer, a crisis intervention trained officer. So these are officers in most counties allow them to volunteer because they don't want them to force that on anyone. But so they're your average police officer who is, yeah, there you go. Excuse me, I'm sorry. Training to learn more about mental health crises and what that could look like. Ideally, they are a person who said, I'm interested in being a bigger and larger support to my community in this way, because we don't want to criminalize someone for experiencing a mental health crisis. So I'm going to go to these trainings. If I'm not mistaken, I believe they get an extra week, which of course in the eyes of someone who might be a therapist, it's like, that's not long enough, but I know we got to start somewhere. And so they ask for a CIT officer to come to support because they have some techniques and things that they've been taught so that they can better support someone experiencing a mental health crisis.
Thank you. I did put that in the chat if anyone wanted to write that down. Thank you for that information, Danielle.
Yes, ma'am. And we're going to go back to that too before it's over with crisis services. So that we're going to circle back to that at the end.
Okay.
The thing I wanted to bring up before we really get to the end are some barriers to therapy. We've talked a lot about everything else other than this. I wanted to be really intentional about some of the graphics that we use because, you know, I'm telling you all these things. I'm throwing out all these words, all of this clinical language. How do we break it down? How do we choose a person? And I'm saying this as if most of the time when somebody's looking for therapy is because I'm actually having a need. Here I am depressed and you talking about all of this. Girl, what? And it feels like you can be lost in the forest. And now I'm going to add a little bit more to your already overwhelming feeling. And as you see, you have arrows that point to nothing because these are barriers to therapy, and everything is going to end up pointing you right back to nowhere when we start to think about how all of this can really compile. One, affordability. We see inflation, we see where we are in the economy. Every day, we don't know, for those of us who are watching the news, if we're up or down. You know, we watch the presidents might get cut off, groceries are up and down, gas is up and down, COVID is on the rise. I mean, we just really don't know what's happening. And so now I'm saying, hey, this is taking a toll on your mental health. You should get therapy. Okay, great. How much is it? $200 a session. Oh, okay. So, how am I supposed to afford this? And so when I think about this as a barrier, of course, we often think about insurance. Some insurances may have coverage for your mental health needs. Some of them do not, or the coverage is not necessarily sustainable for someone and the need that you have. One of the things I want to offer to you is if you are a person and you feel that your mental health is in a place where you absolutely need someone to work with, maybe consider finding an agency that supports graduate students who are completing their internship and finishing their degree. And I say that because they may be able to offer you therapy at a free or reduced price. They may be able to offer you a sliding scale. Consider looking for services in, you know, during what would be typically an academic calendar year, because that's when you might be able to have better access to that. I would also say consider working with someone who may be provisionally licensed. I find that there are times I've worked with people that say, well, I didn't want to work with anyone who didn't have their full license. And if you're a person who is covered under Medicare, then and you're using that for coverage, then that's not an option for you anyway. But if you are maybe paying out of pocket or you have a coverage that allows for that, that might be an option for you. And that's something you could pursue to increase affordability. Another option or another barrier that we see is access to quality care, because many times we need referrals to get into services, and we have no one to refer us. A lot of the systems that are in this area that offer services require you to have a primary care provider or some other doctor within the system to send the referrals to behavioral health. And then that means now I got to get an appointment with my doctor, and that's going to take me 2 months. And then I'm gonna go to them, and then they want to know what's wrong, and I have to tell them, and then they're gonna put the referral in, and then now I gotta wait on the referral. They're gonna call me, and then they're gonna send it off to this person. And now I go right back to the first barrier, which was the affordability, because is this in line with my insurance? And then the last barrier being the wait list, because the whole time, one, they may have a wait list, but also the clock is ticking on you, because from the time you decided, I think that it's time for me to move forward with seeking support, to the time it takes for you to actually get in the door, life has not stopped. Life has not stopped. You still have to do all the things that were on your plate, or you've decided to not do some of those things in order to kind of survive. And you're still waiting to find this person and hoping that it's someone that you can build a rapport with and you're comfortable enough to share your needs with. And so when I think about solutions to those things, my thoughts are look to some of your smaller community-based agencies. So many times at my work, I've heard people say, well, I wanted to come here because this system is supposed to be X. And I've tried to refer them to a different agency that's community based. And because they thought that, oh, I thought they only did issues. I thought they only did ADHD. And it's like, while they may be known for one particular service, oftentimes they offer a variety of treatments. And we don't want you to miss out on what could be very good for you because of the stigma that may be attached to something else that you're not even receiving treatment for, number one. So just take the opportunity to explore, because that might be someone there that could really provide what you're looking for. And in terms of wait lists, this is going to sound bad. I'm really going to kick myself because I know it can be bothersome sometimes on the other person's end, but keep calling. When you're on the wait list, it's somebody's job to answer the phone and or respond to the message and ask if you can be moved up, right? Somebody's supposed to be doing that. Who cares? I've heard so many people say, I don't want to keep calling. I don't want to keep getting on their nerves. Why not? You need help. This is Bobby's whole job is to answer the phone. One day, my whole job is to respond to crisis calls and look at orders in the system, right? Like, this is what part of what you're paying me to do. It doesn't matter. And hopefully, we shouldn't be answering the phone with attitude. That's part of us being here, and this is part of mental health anyway. But my point is, do your very best to advocate for care, because we don't want the clock to run out on you. I would rather someone call me, 5 times a week, even if you said, okay, I'm going to call twice a week every week until, just to see if they can move me up. I would rather that happen than for me to receive a call. And I've had this happen before where I find out that someone has harmed themselves and they're in the ICU because we couldn't get them an appointment any sooner because we genuinely didn't have the availability, but happened. So I don't mind. I don't think anyone minds taking that call. And it's unfortunate that I've heard so many people say, well, I didn't want to keep doing that. I didn't want to bother anybody. Bother them. We rather be bothered than you be in harm's way.
The squeaky wheel gets the oil.
Yes. And I promise you, it's some people that's squeaking that I'm not saying they don't need help. Yeah, they get oil. And you might they could use a little less oil, maybe. And so, as I said, I did want to circle back to some of the crisis services. So, number one, in the meantime, right, because I've just talked about like all these barriers that get in the way of therapy, like beyond getting over that mental block to make a decision. So, in the event of you feeling that you are in position where you want to harm yourself or someone else, and I'm saying general harm, right? Like, I'm not saying that you even want to kill yourself. You don't have to want to end your life. You could just want to harm yourself. Why don't we try calling or texting, because texting is an option, 988. That is one of our psychiatric suicide crisis lines, national. And you can call or text them. That is 24/7. Also, as we mentioned, you have the 911 option where you can request a CIT officer if you felt that you had a psychiatric or other emergency, medical, of course. And then I am in Wake County. I don't know where everyone is, but I am here and available to help you find mobile crisis numbers if you would like for whatever area you're in. So in Wake County, the mobile crisis provider is Therapeutic Alternatives, and this is their contact information. They're also 24/7. Mobile crisis is an additional service where it's not like the suicide crisis line where you may be speaking with someone who is nowhere near you, but this is an opportunity where you can speak with a licensed provider and they're able to come out and meet you and or get you connected with the next service if y'all deem that is necessary. And so sometimes that might look like you talking to them about what's happening in your life at that moment and y'all together making a decision that inpatient treatment may be needed. And so that is a part of the work that they do. Is there anybody who lives in a different area that would like a little bit of support, at the end of this with finding out where their mobile crisis provider is, if there is one in their area? Pitt and Wilson. Gotcha. I can do that. All right. And the last part is questions. And so I will take any questions y'all have. And right now, while I have it up, I'm looking on my phone to find the mobile crisis providers for Pitt and Wilson County, but I'm still available to take any questions.
Hi, my name's, oh, sorry.
No, go ahead, please.
Yeah, so my name is Angela. I just wanted to also add on that sometimes I know you were saying like different people may not can access therapists. A lot of people don't know that their employer sometimes may have like an EAP program, and you can get like
Yes.
a therapist. Now it's more short term, but it is something like if you have like a crisis, or not say a crisis, that's wrong word terminology, but more so like if like, you're just kind of going through something like your grandmother just died, or you're transitioning from a different relationship and you just need to just really talk to someone, it's supposed to be like a fast turnover rate. And I mean, I think that could help out with people who may not have a lot of money for the sessions, because the sessions are paid for by your employer. Most EAPs actually partner with licensed therapists. And so, they would have the expertise to help you out. But it, like I said, that's good for those short-term things, and to kind of hold you over until you can get in to see like a therapist for like long-term types of situations.
Yes. Thank you for that.
Yeah,
I
No
just,
pardon my misspelling. I was typing too fast. Well, it's employee assistance plan. It's the EAP plan.
also,
And
if y'all
thank
look
you.
in the chat, so the mobile crisis provider for Pitt County is Integrated Family Services PLC, and so the phone number is there. And let me find the one for Wilson right now. Based on the internet. Any other additions or questions?
Well, I know, Danielle, when you were talking about the different types of care, and before that a little bit, you had mentioned like, psychiatry or medicinal treatments for mental health.
Mm-hmm.
And could you just give us a little bit information about the difference between a psychotherapist and a psychiatrist?
Yes. So, okay, great. So a psychotherapist is kind of like with psychotherapy is someone who is providing talk therapy. Um, we'll go back to that because that's kind of loaded. A psychiatrist is a medical doctor. So they have been to medical school and they specialize in psychiatry. They can prescribe medications for you. They may supervise nurse practitioners or PA students as well. I mean, excuse me, not PA students, PA providers or mid, or what they may refer to as a mid-level professional. But psychiatrists are medical doctors. And so sometimes I think when people come in, they may confuse them with psychologists. The psychologists are not prescribers. They may have a PhD or a PsyD or other doctorate title, but a psychiatrist is an actual medical doctor. In terms of the therapy terms, like therapist, a lot of times people use that term in reference to someone who is, well, I often hear it in reference, they're referencing someone who's licensed. Licensed meaning they are affiliated with a state board of some kind. So I'm a licensed clinical social worker and licensed clinical addiction specialist. But there are also persons who are licensed with the state for counseling. They were previously referred to as licensed professional counselors. However, the designation changed about 2 years ago to licensed clinical mental health counselor. So you may still see a little bit of overlap with folks as y'all are kind of looking at some of that. And it looks like Port Human Services provides for Wilson, and I'm going to put that information in the chat as well in 1 second. Another thing I wanted to say in regard to the counselor, therapist, clinician topic is we also hear people talk about counselor, and sometimes that term has been used to refer to someone who may be licensed. They may not be licensed. That is a term we've seen that has been used sometimes more loosely. What I want to say is, while licensure in and of itself does not mean that this person is not experienced and that they cannot provide support and care for you, licensure does indicate that there is some type of board and ethical guideline that they're expected to follow, and there are people who are ensuring that to an extent. So if something were to happen within your care, there is a stop point, if you will, or someone to report it to. So if you were to see someone who may identify as a counselor, yeah, they provide oversight. Thank you, Nikki, because I could not think of the word. They're providing some oversight. Versus someone who may say, well, I can counsel you. And they may say, I'm not licensed, but I have a lot of experience in X. Well, there's not necessarily someone who said, well, this person has had, completed all the qualifications that we have identified as necessary to provide this level of care. And they are able to practice within this scope. So that is what that means.
Thank you for letting us know the differences, because I'm sure it can get confusing to people when they see all the different titles.
Yes. It's a lot. We're human. So they have psychological motives. Wilson seemed like they got a lot of things happening in Wilson. I just want one thing, Wilson. Okay, so we still getting that done. Any other questions?
Okay, I think we're good.
Well, thank y'all for having me. I'll stop sharing my screen here and I'll still be information in the chat. I really appreciate it.
Thank you so much for coming and presenting for us today. It was very informative. Hopefully it was able to give people the insight necessary for them to take the next step. That's what I'm hoping, that maybe there were some people, or people that are here know some people that were kind of like on the fence about whether they were going to, pursue support. And hopefully this gave them the information, so that the clarity, so they can take that next step. So we appreciate your time and your information.
Thank you. And feel free to reach out to me if there's anything that I can do to help going forward.
Yeah, I'll be posting this recording on our YouTube channel and on our website. So Danielle, I'm sure Nikki can send you that information, just so if you wanted to view it or share it, or
Yes, I will.
But thank you so much.
You.
We encourage you to view it and share it. Thank you. Thanks again, Danielle. Thank everyone for showing up. Welcome to the people that are here new. We encourage you to come back and visit us. We do this every Wednesday, as far as a group session type of environment. And then every third Saturday or so, at least once a month, we do a session like this, where a professional like Danielle gives us all the types of great information related to mental health. So we ask you to visit us at lmfoutreach.org, which is our website, for more information, more videos of this type, individual interviews, as well as our YouTube channel. So thanks, everyone. Have a great Saturday. And thank you for coming out and being with us.
Thank
You're
you.
welcome. Bye.
Bye.
Bye.